my name is Dr. Ibby. I'm a naturopathic physician and also a registered acupuncturist. My practice is actually in BC, Canada, and I have pretty much a general practice, but I have been looking to focus more and create a niche for myself as a naturopathic physician and also as an acupuncturist. I'm in White Rock, South Surrey. I'm actually outside of Vancouver, BC. I went to school at Busier University, so I got both my degrees at Busier, and I've been practicing for 12 years now.
You're part of our Film and Practice Fast Immersion, and you ended up later being a part of our 14 Days program, so we'd love to talk to you about your experience with both. What was happening for you before the Film and Practice?
My practice was what you call a feast and famine kind of practice, where I'll have people come in. So I just had these periods of time where I'll be busy, followed by periods of times when I really wasn't busy. It was just stressful on a lot of fronts. It was super frustrating because I knew that I had skills to help people, but I definitely was having a difficult time connecting with the people that I want to work with and the people that I feel would want to work for a practitioner like me. So I will probably say yes, I was at a level where I was really frustrated with my practice, and it felt like I was just spinning my wheels.
How is that affecting you?
It's stressful. I'm married and I'm a mom, and so I think it was definitely stressful for us financially. Emotionally, it was just discouraging to know that after all my years of experience and what I had to offer, I just didn't feel like I was where I wanted to be in my practice or where I felt I should be in my practice, granted what I had to offer. I think on a lot of fronts, like emotionally and financially, was super stressful. I have two boys, almost 10 and a 7.5-year-old, so it's definitely busy.
I bet. You had practiced in the States, and then you had moved. Share a little bit about that, what that experience is like too.
Yes, I loved practicing in the States. This was 12 years ago. I was part of a big multidisciplinary clinic. I was very specialized, graduated because I was basically trained by a group of urologists. And so I had a very niche and a very specific practice, and it was great. Moving up to Canada the laws are different. The scope of practice is definitely different. I felt there wasn't as much of a collaborative spirit here in Canada. So that was difficult for me to kind of make the switch from working with medical doctors and other healthcare practitioners to provide care. You're definitely more on your own here in Canada. It's different because we have a universal healthcare system, and naturopathic doctors are not really under that umbrella, so people have to pay out of pocket or they have extended benefits. My experience was that people were willing to see a naturopathic doctor as long as it was covered by their benefits. And the benefits range from maybe $200 to $1,000. And that's pretty much all they get. So it's definitely a lot more difficult to have a practice in Canada versus I feel like in the States. But then in the States you have the insurance problem. So I also wasn't paid in the States, so it wasn't uncommon to bill and only get 50% of what you billed for, but at least you could hire a biller to figure all those issues out for you from that end. It's a different system.
Were you all insurance in the States?
Yes, I was lucky because of my practice that I was just kind of grandfathered in with the other practitioners. I was in Washington State, and I had all the major care providers. I actually was able to get in with them. And it was a lot easier to build up a practice in the States because I took insurance. I did have patients that paid out of pocket, but it was mainly an insurance-based practice. But I think because I was with a group of other practitioners, it made it it was a big practice. So it made it easier for me to be able to collect insurance, which helped me build my practice. But a lot of the specialists and medical doctors were also interested in making a partnership with a naturopathic doctor, which is not the case in Canada. So that also made it easier to build a practice in the States. I think here is definitely similar to doctors practicing in unlicensed states. In the States, I have a cash practice, so it'll be very similar.
And so what's changed for you since you took the leap and to be a part of the Film and Practice Fast Immersion as a first thing that happened working with us? Mm-hmm.
When I first did that, I think what really changed for me was being able to talk to potential patients. So I felt like I offered a discovery session for people. It was 15 minutes. A lot of times people will come in and we'll have a chat, usually for 20 or 25 minutes. They really wouldn't necessarily book an appointment. After the immersion, the first one that I did, it gave me the tools when people came in to be able to help them make that decision that they wanted to work with me. After I did that, I did notice a significant improvement in, I'll probably say 80% of people that came in for a discovery session end up becoming a patient and they'll book an appointment. It was super helpful to know how to talk to people, to let them know that they were in the right place.
That's great. What was it before? What percentage was it before, would you say?
I'll probably say 50%, maybe even less. The other thing I also got from the Film I Practice first was going out and talking, and basically a structure and how to organize my talks, like trying to do a talk a month and going out in the community. And that was super helpful as well, because that also helped build my practice when I started doing that.
Great. And how did it affect your income?
Before doing the immersion program, I'll probably say like my practice was just breaking even. So I wasn't going in debt, but I also wasn't really making any money, which actually I think I did go in debt. Like I had to work. I had to do a part-time job. I did a part-time job for about 2 years, because without the part-time job, I definitely would have been in debt. And then I just took the leap and went into practice full-time. So I definitely, within 2 years, I was able to start making money in my practice. So that was nice to actually finally be able to cover all my expenses and also be making money.
Great. Would you say you enjoyed the immersion experience?
I think my favorite part was just being able to partner up. Like, I've always liked, it seems a lot of the workshops you do, Chen, they're interactive and it's participatory. So it was really helpful to be partnered up with somebody else and have exercises to do and then get feedback. The templates were also very helpful to just have different scenarios and to have a template to work off of. That I found that very helpful as well.
Which changed for you that you're really excited about?
Over the course of the 3 months, it really made me, number one, realize my worth and my value, that was a surprising thing for me, because I was just more interested in how to do a signature talk. I've been wanting to do a signature talk probably for 3 years or longer, and I just had no idea how to put one together.
Tell us a little bit about that, because you were giving talks before, right? What it was like before for you with giving talks?
Well, I would give talks and people would say it's a good talk, but then I really wouldn't convert. People weren't coming to see me. They got information from the talks, but it wasn't really leading to more people becoming my patients. I think it's one thing to give a talk. It's another thing to give a talk that actually converts and gets people to sign up and want to be your patient, and then also spread the word for you, which is what I see a good signal, is that people are excited to work with you, but they're also excited to tell other people about you, because it's very focused. So people would know that how you could help them, as opposed to just doing a general talk about something.
When you were giving talks before, like how many people used to be there and how many patients would come from it?
I've had talks where there are like 10 people, 12 people. I've had some talks that nobody, 2 people signed up. That was one of the other reasons I did the mentorship, because I'm really, really passionate about genetics. And I found that people really didn't know what I was talking about. Nobody would show up for those talks. Way to convey that message to people so that they'll be interested and excited to hear what I have to say and know how I could help them. So when I was giving talks, like the last talk I gave people, and maybe 3 people coming in to become my patient, but I feel like I could have used my help. That was disappointing. I've been doing talks for on and off for 10 years now, 12 years, for as long as I've been a doctor. It's just that when I moved to Canada, things are very different here. In the States, I was giving talks to medical doctors, and that's basically how I built my practice within 2 years, by talking to medical doctors and other healthcare practitioners who would then refer patients to me. But things are different in Canada. Talking to the public and getting them to understand how you could help them is very different from talking to who's a professional who can then refer patients to you.
And how come you didn't go the route of reaching out to doctors in Canada?
Canada's system is not as integrated as the States. So there are some medical doctors that practice integrated medicine and they believe in alternative medicine, but for the most part, a lot of medical doctors, especially in British Columbia, my experience was that they weren't really interested in having an integrative setting. For the longest time, it was forbidden for medical doctors and naturopathic doctors to work together in the same building. And so it made it really difficult as a naturopathic doctor to talk to medical doctors. I did meet a couple of them that were interested in what I had to say, but for the most part, it wasn't as easy because I don't feel they really see the value in naturopathic medicine and having an integrative clinic.
So there's more openness to it in the States. So in Canada, it made more sense to educate the public directly more as well.
We have a universal healthcare system. So in Canada, people are kind of paying out of pocket to some extent to see you as a naturopathic doctor. I think naturopathic medicine is definitely more driven by people. That everybody, especially in British Columbia, about 40% of the population, maybe even more, use some kind of alternative medicine in conjunction with allopathic, with conventional medicine. So it kind of made sense to just speak directly to the public about how you could help them.
What do you offer as part of your practice, and how much do you charge?
So I offer, well, I guess for the most part, I have a general naturopathic practice. I do some limited testing, so food sensitivity testing, and those are just, the charges for those is based on whatever the company recommends. It's $190 for a first office call, and that's a 1-hour visit. And then I have a 45-minute visit follow-up that people can have, and that's $135. A return office call, which is 30 minutes, is $95. My acupuncture fees are $130 for my first office call and $90 for a return. My visits are an hour for acupuncture and an hour and 15 minutes for the first office call. Then I do offer a facial rejuvenation package, and that's 10 visits for $1,200.
You offer genetic testing?
Yes. Actually, I do the analysis. So I was finding that people were doing their 23andMe, and then they were using direct-to-consume platforms to understand their genetics. And everybody says, oh, I didn't learn anything from doing it. So I do offer genetic analysis, but it's definitely more from a clinical perspective. I'm using it to really help me figure out what's going on with some of the more difficult cases that I have. And they want something a little bit more personalized and customized to themselves as opposed to just general advice.
What else has changed as part of the journey for you and in the six-figure Speaking Makeover Mentorship?
I started out my practice with a specialty in urology. I was actually trained by a group of urologists in Seattle. And by doing the mentorship, I realized that it's a area that I like and I'm really good at. And it actually is super helpful to let people know how you can help them. You know, as much as I can help people with so many things, it's been nice because I've now narrowed down my focus, and the mentorship has really allowed me to be a little bit more laser focused about what am I doing? What do I love to do? Who do I want to see? I am now thinking about actually implementing a questionnaire so that people do their complimentary 15-minute visit with me. There are a bunch of questions I'm going to ask them so I can figure out who's a good fit for me and who isn't a good fit for me. It's just really allowed me to become very focused on what I want to do and how to get there. So that's been really nice to actually, instead of floundering, to actually have a goal of what I want to do. Because of the mentorship, I'm paying a lot more attention to my financials, which I never used to do. That was something I definitely learned from you, Chen, like how you have to kind of, you know, whatever you put your attention to is what's going to bloom and what's going to grow. So now every week I'm paying attention to how my practice is performing and what my financials are like. That actually helps me not get complacent about my practice and just have a really good idea of, am I meeting my goals? And am I meeting my targets this week? And if I'm not, what can I do to make sure I'm doing that?
Awesome. Yes, because you have met your goals, right? Tell us a little about that.
Throughout all of this, despite us being in a pandemic, I am getting busier. My advertising is becoming a lot more laser focused, right? So now people are like, oh, okay, yes, I have that problem and I'm going to come see her because she seems to know what she's talking about and she could help me. And I know that's something that I struggled with throughout the entire 3 months is what do I want to focus on? And you know, what message do I want to get out? Who do I want to help? It's been busier, and I'm actually in the stage right now that I'm like, oh, okay, I could choose who I want to work with, which is a nice place to be. It's nice to be in that state as opposed to saying, oh, I'll take anybody and everybody because I need the business. And now I'm just like, no, this is the type of person I want to work with. This is the type of work I want to do. And making sure those people find me and I find those people so that it's a nice fit, and then it's a win-win for everybody, which has been nice.
Yes, it's one of those things where it seems like, you know, many times when it's said like, oh, getting clear about what I want to do, and it's just like when you first hear it at a glance, it doesn't seem like it's that big of a deal. It's like, oh yeah, we'll just figure out what you want to do, right? But every stage of growth in a practice, because it wasn't like you were coming from like no patients, right? But because you already had a practice, but then every level of growth and up leveling, there's just this next level of clarity and evolution of your practice as you evolve as a person, as you evolve in your interests. Something else bubbles up where you just don't feel like this is really how you might necessarily want to practice, but then not also knowing what exactly it'll look like, right? It's like that feeling, isn't it? Right. The speaking side of things, what has happened for you there? Tell us a little bit about that you're excited about.
I had a connection with a compounding pharmacy that's in my community, and the old manager and I actually really got along, and they were actually sending quite a number of patients to see me. And through the mentorship and me just getting clear on, okay, what kind of patient do I want to work with and what do I want to do, I'm now back in talks with them to do webinars because they're a big compounding pharmacy, I think with about 16 pharmacies kind of spread all over the lower mainland where I'm at. So there's this opportunity to actually be able to do webinars, and all their database of people basically would be able to be exposed to my message. Because of the mentorship, I'm just getting just laser focused. I'm just becoming a lot clearer about what I want to do and who I want to target, and just really working as opposed to spreading my energy all over the place and hoping that something sticks. So it feels nice to actually have a plan and say, okay. And it's also nicer having a speaker one sheet, which is like amazing. Because with that template, I'm like, well, this is what I can offer. And then it's easier for them to market me because they know exactly what I'm going to talk about. And then only those people that are interested in that are going to watch, and they're going to reach out to me. And those are the kind of people I want to work with anyways. I'm super excited for that opportunity. And I'm also looking into doing some training for their staff, which in a sense kind of helps my practice, because the more they're trained in what I do, then the more they could actually send people my way. People that would be a good fit for me and that want the services that I'm offering.
Awesome. And what was it like for you to have the done for you templates and scripts?
I have 2 kids. I have a full practice. I'm a busy mom. I actually started the process before I started the mentorship of trying to find a speaker one sheet. And it's not easy. It's just because there's something out there that gives you a template doesn't mean it's necessarily going to work for you, especially as a healthcare provider. So that was really nice. That was one less thing. It's a plug and speak kind of thing. You know, I just plug in my words and what I want to do, and it's kind of like ready to go. So that was nice. That was one less thing that I have to think about and fumble around with for months. So I'm super happy for that.
What was it like to be, like, what did you enjoy most about the 6-figure Speaking Makeover Mentorship?
I liked the group, getting together in groups. I think that's very nice and was super helpful. Having those breakout sessions were really helpful because it's just nice to have 2 other people sometimes listening to you and then giving you advice. And so there's some things that I wasn't thinking about. Actually, I wrote everything down during the mentorship, and going over it, now I'm just like, oh, I know exactly what I do. I know the kind of people that I attract, and I know what I'm offering. And those are now taglines and words that I could use on my website. I could use in my advertising. And I don't think I would have been able to figure that out without all the feedback from everybody else in the group. And the momentum laser session, that was also very, very super helpful. I believe it's Jen that did that.
Yes, one of our coaches.
Yes, that was like a very nice bonus. I love the templates. There's so many templates and it's a lot of hours that is saving me. I'll probably say I'm still going through all the templates and thinking, oh my gosh, this is like a treasure chest that Chen just gave me over the past 3 months. When we're doing the program, there's a lot happening. Now that I'm sitting down, I have a big binder in, and I just feel more confident. Like I kind of feel more confident that, okay, I have everything I need. I just need to do it now. And that's a really good place to be, as opposed to feeling like, oh my God, I have to go find all this information. I don't even know if it's going to work. And that's the best part. I have templates that work. So I don't have to, reinvent the wheel or anything like that. I just have to put my voice and my message into it and just follow the script, which is super nice.
How has this been different from other kinds of business trainings you've done in the past or in school?
The only business training I had was in school, and it hasn't served me. And my first introduction to, having a coach was actually you, Chen. So I realized looking back, I reached out to you 3 years ago, which is kind of crazy that it's been that long. I did one session with you, and it was a very short kind of 2-day thing. And I implemented the stuff that you told me and it worked. And so I'm kind of like that. I tend to kind of find my people. And so I haven't really searched anywhere else because I'm like, well, she's taught me some stuff and it worked. And so I know you and I know it works. So it's just easier to just keep going with you. And you also knew my story and I just didn't want to start all over again. I wish I got you 10 years ago. I think my practice and my finances would be in a very different place right now.
And when would you say some words of wisdom or advice that you have about growing a practice? Perhaps first, looking at it in the US and then also in Canada. What would you say, looking back now, like what's some advice you would give about that to other practitioners?
No matter where you hire Chen, and if you can't hire Chen, like definitely get a coach. I'm amazed at all the stuff. You could be honestly the best doctor on the face of the earth and still not make it. And what I've noticed is that the people that are thriving are not always the best doctors or the best practitioners, but they're the ones that have coaching, they have training, they know how to get their message out there, they know how to get recognized. And so it doesn't really matter if you have a really great product or a great service and nobody knows about you. So I would definitely recommend to get a coach and get a better understanding of the business aspect of medicine, because it's a business. And if you don't treat it that way, you're going to wake up 12 years later and be very disappointed that you're not as far ahead as you expected yourself to be. It really doesn't have anything to do with your capabilities, but more so with your business skills or lack thereof. That's probably the biggest advice.
And any other pearls you'd like to share? For example, having started a practice in Canada too, what would you say looking back? Like maybe you wish you had known when you had started and yeah, we could shortcut things for other practitioners.
Honestly, I think the only thing is that coaching aspect, right? Because the environment was so different and I didn't really know anybody here. So I didn't really have, if you could get a mentor, somebody to talk to just get an idea of how things work. I spent a lot of money doing those networking, like I did BNI, and I joined a bunch of networking groups, and none of them really grew my practice as getting coaching. So that's the biggest difference. In the States side, I had a mentor in the States, like she was a medical doctor and she just took me under her wings, and she's like, do this, do this, do this. So I'm like, okay. And 2 years later, I had a 4-week wait list in my practice. And so having a mentor that can actually guide you is invaluable, I feel, in just being successful in growing your practice.
Looking ahead, what's your vision?
I'm excited to put together an online course, and I'm excited that I kind of just see all the possibilities of my practice that maybe I wasn't really aware of before. The mentorship has just really kind of opened my eyes to so many ways of doing things that are easier and maybe will enable me to get to my goals. I'm looking forward to kind of putting together an online course and webinaring, moving to that next stage of getting things automated and having a portion of my practice. I always say I want to be in Bali or somewhere. I want to be somewhere else in the world, living my life with my family and still making money and still helping people. So I'm kind of, that possibility and how it could happen is actually, I can see it now, and that's super exciting.
Yes, because this skill set of being able to inspire people through speaking is like something that no one can take away from you, right?
Yeah.
How do you manage it all, being a mom of 2 kids and working full time? What are some of your hot tips there?
I honestly just try to, not get distracted. So I always tell people, don't put me as your emergency person. I don't have my phone on me. There's I think a tracker or a tool that you gave me that I started using. I try to be organized and efficient with my time and kind of figure out, okay, prioritize things, right? So what are the things that are a high priority and when am I going to get them done? But probably the biggest thing is self-care. So I work out every day, and I do yoga, I meditate, I make sure that I actually have time to take care of myself, because if I don't, then there's no way I could do all this stuff that I want to do. And I guess because I have a family, I'm just okay that it's going to take me longer. So I've had to make peace with the fact that, okay, it may take me a year, maybe 2 years, but I'm still kind of working at it every day. Just not putting that pressure on myself has been helpful.
Yes, well, getting to where you have gotten to is something you should be proud of, right? Like being a full-time mom and and full-time naturopathic doctor, having this interest. What would you say to someone who might be on the fence?
Do it. I'm going to say do it. And I know I actually spoke with you initially because I was just like, oh my gosh, financially, I don't know if I could make it happen. And the funny thing is, it did happen, because as we were doing the program, I was implementing things. Like as I became more clear, then I would start implementing things in my practice, which then made it busier. So at the end of the day, I was able to I paid for the program and then I got busy. So the money will come. I would say if somebody's hesitating, that I totally understand that it's kind of scary to take that jump, but you'd be glad that you did.
Well, thank you so much again for being here and being an inspiration. Congratulations for all the progress and success you've made and the growth in your practice. So thanks for being here today.
Thanks very much, Chen. Thanks for being so instrumental in me seeing a way to make my vision for myself and my family come true. So super grateful for you.
Oh, thank you. By the way, how's your husband feel about this all?
You know what? It's good because I'm happy, right? He wants, to say happy wife, happy life. So it's he has a wife who is happy, and I think, when I'm happy and I'm in good spirits, that kind of spills over to him and it spills over to the kids as well. And so he's super happy for me. And I think he likes the idea of my life being a little bit more streamlined. So at the end of the day, it's that, freedom to spend more time with him and the kids. And so I think, he's very supportive and super happy for me. He's my tech guy, so he has to help me do all the editing and all the computer stuff that I don't know how to do.
Nice.
And actually, it's getting him to think about it. He's an RMT, is making him think about his practice as well. So, which is that's really good.
Nice. Very nice.
Yeah.
Thanks again. For those of you who are listening, watching, and are in a place where your practice is at a plateau and you would like it to be busier because you just know that you're capable of so much more, and you'd like to see a growth with your money, that your income as far as being commensurate with your experience and skill sets more too, then feel free to reach out to us at introvertedvisionary.com and book a free strategy session with us, and happy to give insight and see how we can help you. So also, if you're at a point in your practice where you're too busy, then we can help you with with that next level of scaling to multi 6 or 7 figures and have it run without you. So yeah, so it's introvertedvisionary.com. And thank you again for joining us today.